Stone-Houze, and today I'll be talking a little bit about Toxicodendron Dermatitis. Essentially, this entails poison ivy dermatitis, but poison sumac and poison oak will also be mentioned as well in this PowerPoint. This PowerPoint will include essentially what it is. I'll also be giving some signs and symptoms as well as the appearance of Toxicodendron dermatitis, management of the dermatitis, and I'll also be giving a brief case study as well, or going over a case study, excuse me. So what is Toxicodendron dermatitis? Essentially, it's an allergenic dermatitis, that occurs when the epidermis is exposed to urushiol oil, which is an irritating oil that is produced by the members of the plant genus Toxicodendron. This includes poison ivy, poison oak, and poison sumac. It's kind of like an itchy rash. Here are some quick identification differences between the three plants. Poison ivy has 3 leaflets, just like poison oak, except poison ivy's leaves margins are smoothed or toothed edges. Poison ivy has smooth or toothed margins, while poison oak's margins are either lobed or deeply toothed with a rounded tip, and they're located along the eastern or southern parts of the US. Poison sumac is completely different. Its leaflets are about 7 to 13 with smooth edges, and they are located in the swampy areas and bogs. As you can see in these 2 pictures, poison ivy can look different on different skin. Diagnosing poison ivy is mainly based off of visual analysis. It consists of multiple tiny raised bumps, vesicles, and lesions. Like I said before, it's an itchy rash that can either be crusty, flaky. It all just depends. Symptoms include an intense itch. As I said before, there are skin lesions, swelling, oozing of the skin, and there can be skin redness. But of course, the skin redness does also depend on skin tone as well, because as you can see in the picture to your left, his or her skin tone is not lighter, and of course they do not have skin redness. And here are some ways that people do manage or tolerate their condition or their dermatitis while they have it. So many people go with the natural way, the topical skin treatment, oatmeal baths, or the cool compress. And then there are other people who do the antihistamines, and they also assist in relief, but drowsiness may occur as well. Benadryl is very known for that one. Steroid creams are very popular. They're more effective than antihistamines, but they are less expensive than steroid pills and or injections. Steroid creams are helpful after symptoms start. However, the low potency creams eventually become ineffective in relief after the first few days. For example, 1% hydrocortisone will work well the first few days, like 1 to 3 days. It'll work pretty well, but maybe a week and a half in, it won't work as well as it did the first 1 to 2 days in, which is why it would work better to step it up to a 5% Timavate or an Ultravate cream, ointment, or gel. Then there are also steroid pills or injections. A lot of people do steroid pills and injections for more severe cases, and if they have a rash that covers a large area. This is not included in the slide, but steroid pills and injections are also for people who may want to use them if their facial or genitalia area has been affected by poison ivy dermatitis as well. A good pill for steroid pills would be prednisone or T-acenide as an injection. Usually there are secondary skin infections after poison ivy dermatitis or any other type of Toxicodendron dermatitis, a lot of people use antibiotics for that as well. Moving on to the case study. The following regards as a case study about a man diagnosed with poison ivy dermatitis contact. Jim is a 44-year-old healthy man living in a rural North Carolina area who came in with itchy linear crusted patches on his left wrist. 2 weeks earlier, he was working in his garden of his backyard while wearing shorts and a t-shirt. By the next morning, the appearance of vesicles and or blisters had made an appearance on his wrist, a streak-like appearance on his wrist, and streak-like arrangements. He's been using 1% hydrocortisone cream for an itch and to reduce the swelling, and polysporin ointment antibiotics several times a day on the affected area, but without much improvement on the rash or the itch. While the patient does not recall interactions with animals, he notes that he has observed several flying insects around the property. The patient suspected that the eruption was related to a pointy three-leafed plant that he accidentally cut in the backyard, but he cannot be sure. Physical examination revealed set boundaries and brown linear streaks on the left wrist. The rest of the physical examination was normal. You diagnosed Jim with Toxicodendron Dermatitis, poison ivy dermatitis. Was my diagnosis correct? What was my best evidence for my diagnosis? Well, I would deem diagnosing Jim with poison ivy dermatitis appropriate. If he were in the backyard doing some type of labor and cut one of the poisonous plants, it would release the urushiol oil, which is both colorless and odorless. So he would have no idea whether, it got onto him, or he would have no idea because it doesn't smell like anything, and he couldn't tell. Based off his description of what he was wearing, his arms and legs were exposed, so it can be assumed that the oil got onto his skin, and at some point it was immediately absorbed due to its ability to quickly absorb into the fats of the skin. The oil was the cause of the itchy reaction within the 24 hours of contact. He described the plant as having 3 leaves, so that would automatically eliminate poison sumac because it has 7 to 13 leaves. And poison oak is not as pointy as poison ivy because it has a rounded tip, so that would only leave poison ivy, which means it's poison ivy dermatitis. In your opinion, why didn't the medication that Jim was using have any effect on his symptoms? Well, 1% hydrocortisone steroid cream is not strong enough because of how low the potency is. As I said before, the cream is only meant to be used the first few days after contact is made. If he wants something more effective, he would be better off by using something with higher potency like 5% Timavate. The antibiotics are more likely only treating a skin infection, or he's just using antibiotics incorrectly. Jim states that he is an active father who plays regularly with his children. He also coaches his son's wrestling team and states he has a lot of physical interaction with the wrestlers while teaching new skills. He is worried that he could potentially spread his rash to his children or to the children he coaches. Based on your initial diagnosis, should he be? What is your recommendation? First, poison ivy is not contagious, and he should keep going about his life the way he usually would, but with more awareness of his surroundings. And although this is not in the slide, it is important that Jim would wash his clothing that he was wearing while he was infected, because the clothing does in fact carry the oil, and anyone who touches the contaminated clothing can in fact be infected with the urushiol oil and get poison ivy dermatitis. So it would be important that he washes his clothes or throws them out, as well as clean under his fingernails constantly, and is just more aware of where he is and what he is cutting. Conclusion. The research done on the Toxicodendron Dermatitis and all its aspects of identification, symptoms, and treatment was able to properly provide me with enough knowledge to properly diagnose Jim with poison ivy dermatitis by piecing clues of his physical conditions and where he was environmentally.